Good morning, everyone. Thank you for being here. We're thrilled to present cat population crisis and data-driven TNR in Mumbai, India. I am Charu Khosla, the chairperson of the Feline Foundation, and with us we have Pallavi Kamath, the executive director of the Feline Foundation. Since 2017, the Feline Foundation has had a primary focus on stray cat welfare, and our work is built around three major programs. Population management, through our sterilization program, we've sterilized over 13,000 cats to date. Medical rehabilitation. Our low cost community clinic has provided for a treatment for more than 40,000 stray cats and dogs till date. And our rehabilitation program has successfully cared for over 2,300 injured and sick cats. Lastly, the community involvement, where we engage with local caretakers, feeders, and residents. And this community driven approach has been an important factor in sustaining the project that we're about to present. Let's first talk about Mumbai, which is India's second largest metro and home to over 20 million people and counting. Even for such a large city, we've had no official cat census done till date. We've had no reliable numbers on cats. But based on anecdotal data from NGOs and veterinarians, we know that there are easily 500,000 cats or more. We can dedicate this spurt of the felines in Mumbai to, of course, this rapid urban development where there are a lot of hiding spots and a lot of feeding areas. And another reason is a decline in the dog population. Now, this has been because of a lot of dog spay neuter programs that have been going on in the city for a while. And yeah, this is the only city where you'll also notice where dogs and cats intermingle a lot, which is not the case in other metros like in Delhi in India, for instance, where cats will mostly, stay out of sight. Now, let's talk about who are the stakeholders in the scope of cat welfare in Mumbai. Of course, we have a few dozen non-profits, we have and clinics, and we have two hospitals. In 2023, our municipal corporation began providing a grant for specifically for cat sterilizations. It was the first municipal corporation in India to do so. And of course, next we have animal rescuers and feeders, whose commitment level varies. Most of them will be women, and some of them will take the cats for sterilization depending on the resources or the awareness levels. And of course, then we have our general public whose attitudes towards cats is generally positive, most of the times neutral. But we still encounter a lot of human animal conflicts. And lastly, we have some cultural taboos that exist, which can sometimes hinder our work. Now, let's talk about our focus area, which was Andheri West. It is Mumbai's largest and most densely populated suburb. And you can see from the map and in the images that it varies in its geography dramatically. Because of this diversity, we even within like a few hundred meters, you will see a very dense population, like very sharp population swings. And to manage this effectively in the West area, we have divided it into smaller survey sections. So up until 2023, we operated by giving individual low-cost appointments to the general public all over the city. It would be animal lovers, feeders, or just people from the building societies bringing their community cats in for sterilization. It was only after 2023 when we had some regular funding for our TNR projects. And today we perform 400 surgeries per month, sterilization surgeries, and they're divided in the three categories, as you can see, which are the low cost paid appointments, the TNR projects, and then the municipal grant that we have. A part of which is also what we utilize for our projects. Now, coming to the structure and capacity of how we operate, we have a fully equipped operation theater. We have 4 post-operative wards with 100 cats capacity. We do surgeries 4 days a week, and we bring in the cats a day before for fasting, and we keep them for 3 days post-operatively. In terms of equipment, we have 25 cat carriers for transport and one catching net, and we have 2 catch traps for the hard to catch cats. Our team consists of 4 surgeons, 3 surgical assistants, one program manager, who manages the program in its entirety, and one cat catcher, and 3 caretakers. Caretakers are the ones who care for the cats in the cages post-operative. Now, why we need data-driven TNR? Of course, since there was no official census or existing data to go on, we would be operating completely blind. And by gathering our own data, we were able to set realistic targets based on our capacity rather than, of course, just guessing it. Another thing that this did for us, which was very great, was how to understand, intimately these areas. So, how many cats are there? Where do they move, who feeds them, where do their colonies overlap, and mapping also helped us adjust our timelines and focus the resources where we would do most good and where it was most needed.
So here's how we decided to execute the TNR projects here in Mumbai. So for each area that we work in, we first start with establishing a carer collective. So this is a group of animal feeders and rescuers in the area who can help us with TNR, and they're vital to the rest of the process as well. We then do a baseline survey of the area in which we collect data about the cat population and their welfare status. And based on the information from the baseline survey, we start planning our TNR activities, as well as for how long we would be needing to do the TNR. We then do an end-term survey where we again recall the same data in the baseline. Based on the results of the end-term survey, we either continue our high-volume TNR in the same area, or we shift the area to what we call a maintenance phase, where we just monitor the population and come up with a strategy for sterilizing the few remaining cats in the area. So the first TNR project that we adopted that method for was Versova. So Versova is a borough within Andheri West. It's also where the Feline Foundation is located. And it's around 3 square kilometers in size, and it has a mixture of residential, commercial areas. It's along the coastline, so there's a lot of fishing villages and wadis as well. There are a lot of animal feeders in this area, and because of all these factors, Versova has a very large cat population. So we started with the carer collective of Versova. We invited all of the animal feeders we knew within Versova to a meeting at the Feline Foundation and introduced our TNR project and the goals and how we would need their help. They were really vital to the entire TNR project because they not only accompanied us on the baseline and end-term surveys because they knew every street of Versova and where all the cats were located. They also helped by socializing the cats in the area by feeding them, which made them a lot easier to catch. They helped with the catching of the cats as well, so they actually caught the majority of the cats in the project. And they also monitored the areas for unsterilized cats. So they would send us the location of the cats in a WhatsApp group that we made just for this purpose. So WhatsApp has a location feature, so they would send us the location of the cat and pictures and videos of the cats as well, which was very helpful for the catching process. So the baseline survey of Versova was done from 2023 to 2024. So we first mapped the area of Versova into smaller subzones. So we did this using a tool called Google My Maps, which made it a lot easier to sort out the sections. We use the indicator count method, so we counted every stray cat by site. We also surveyed every street, so we didn't use the transect method, but we instead explored every street within Versova, and this was really important because the cat population really varies from street to street, and it was important for our team members to know the locations of the cats. So here's a survey that we did. So this is a survey for one of the subzones. So there's two portions to the survey. In the top half is where we collected the cat population data. So every single cat that we saw got recorded by a tally mark, either as unsterilized or sterilized, and by sex as well. The bottom section is where we recorded the health of the cats. So if we noted any cat as vulnerable, and we counted 6 categories as vulnerable, which are sick, injured, disabled, geriatric, infant or pregnant or lactating, we noted those cats as tally marks as well. So this gave us an overall picture of the welfare of the population. So this is the baseline data summarized. So we counted 2,085 stray cats in Versova, out of which 37.75% was sterilized, probably also as a result of the work that we had done prior to the survey. 12.23% of the cats were considered vulnerable. Then we proceeded with the trapping activities. So she goes out about 3 to 4 days a week to catch the cats, and we sterilize around 30 to 50 project cats every week. So some of them are caught by the catcher and the rest are brought by feeders. We trap the majority of the cats by hand or by luring them into cat carriers. So we have limited trapping equipment, so we only use them for the cats that are difficult to catch or are completely feral. We take a geotagged video of every cat at location with the carrier number visible. We also ensure that the same team member who catches the cat is also the one releasing the cat so that there are no issues. For those cats who are fed by people or people have an attachment to them or they consider themselves the owners of the cats, we make sure that they are present during catching and release again so that there's no issues. And we also encourage them to visit the cats at the Feline Foundation so that there's full transparency about the process. So once we catch the cats, we get them to our center and our doctors check them for any health issues. After surgery, we keep the cats for 4 days in the post-op pods. And post-op is important for the public because that's something that they're not able to manage at home. So we have to have post-op facilities. Every cat is also ear-notched. We also give anti-rabies vaccine and deworming medication and any other treatment that we can in the time that they stay with us. So over 2 years, we sterilized 2,473 cats in Versova. Once we were confident that the majority of the cats were sterilized, either from our own team members' reports or the Care Collective reports, we did the end-term survey in March 2025. So we did the survey in one day, unlike the baseline, which we did over a staggered period. So this is the end-term survey of the same location as earlier. And as you can see, the majority of the cats are now in the sterilized section. And we made sure to record the same data as the baseline survey. And we did them at the same time of day as well. So here's the data from the end-term survey. This time we counted 1,761 cats, out of which 81.26% were sterilized and 8.4% were vulnerable. We did see a dip in the population as well within the 2 years. We also saw a fall in most of the vulnerable categories except for the geriatric and disabled categories. However, this data was not statistically significant when we did the test. So this could indicate either more intensive TNR which is required or that medical care is also essential along with TNR activities in order to see a decrease in health issues in the stray cat population. After we found out that more than 80% of the cats in Versova were sterilized, we shifted it to the maintenance phase. So we continue to work with the caretakers in Versova to keep the sterilization rates stable and ensure the population does not increase again. So we now rely on them to get the majority of the cats if there are any unsterilized cats. And we send our cat catcher for priority cases only so that now her time is utilized for other zones that we are now doing TNR in. So we're now active in 6 other zones in Andheri West, which is now covering around 40% of Andheri West. We've established new carer collectives in each of these zones. We're also adapting our methodology slightly to these new zones because we're unfamiliar with these areas and the community. So we're adapting some things as we go. Along the way, we've had some challenges. One major challenge is with trapping. There's a major lack of skilled cat catchers in Mumbai. So it's quite difficult to find cat catchers even for the public to help us. The other thing is that, of course, the cats are active on different schedules depending on what time they're fed. So we've had to adjust our operational schedule according to that as well. Another slight obstacle is that the public in general is not used to being involved in the sterilization process at all. So they mostly think that sterilization and trapping especially is the responsibility of NGOs or the municipal government. They are a bit reluctant to get involved in cat trapping. So convincing them does take some time. Another challenge is just tracking the populations and meeting our targets. So now with multiple zones that we're active in and with low human resources in our organization, monitoring the cat populations in all these areas is quite a challenge. It means that a cat catcher has to revisit areas multiple times, sometimes in order to find cats that she's previously spotted or other people have spotted. And if they're not there, then she has to go back again. So that takes a lot of time and effort. So even with the carer collectives, it's quite like time and resource intensive to keep visiting multiple areas and rotating those areas, which is also something that she needs to do in order to meet our daily surgery targets as well. So although we would like to only say work on one area at a time, it becomes difficult if she's unable to find enough cats in order to meet the daily surgery slots. And to make sure that the surgery slots also aren't going to waste, she then visits multiple areas in order to get enough cats. And Mumbai has very heavy monsoons for several months in the year, so that also affects the ability to catch cats quite a bit. And lastly, is keeping feeders motivated enough to continue to help us, because they're all doing this on a volunteer basis, and catching cats is really, really difficult. So we keep them motivated by keeping them updated on the progress of the work and how successful it is, and also reminding them that by not sterilizing now, if we don't do it effectively now, it just means a lot more work is lies ahead of them in the future. So they've also been doing this for many years, so they know the urgency of a successful sterilization program.
The next challenge we will talk about are the attitudes. So, public attitudes in Mumbai are largely favorable towards sterilization or sometimes neutral, but we do have encounter pockets of some resistance. We, of course, leverage people's interests and, make sure that they are aware that the sterilization of the cats is in their interest. And of course, sometimes have to utilize our government partnership, and then this is allowed by law, and that we are a partner with the municipal corporation for the cat sterilization program. We do have conflicts with, especially with resident welfare associations, which are of the building complexes. And sometimes we also have cultural beliefs of certain sections of the society that interfere with our sterilization drives. Of course, another major challenge is tracking kittens. Of course, we do rely heavily on the carers and the rescuers, to let us know as soon as they're 5 months old, so we can sterilize them. In India, we don't practice infant space, so timing is very important. And another challenge is, of course, lactating mothers. We have to, the window between when they stop nursing to like their pregnancy cycle is very short. So again, we count on our local intelligence, which comes from the carers and rescuers, to feed us that vital information. Now, what we would do differently? First, we believe that putting up posters and distributing education pamphlets on the benefits of TNR is very important, and we would do a lot more of it, and we are doing a lot more of it now. By doing this, we're able to sort of raise awareness faster and reduce confusion when our team members do go out trapping. Next is that we would like to have done the survey in one complete go without staggering. That is a very important lesson that we have learned. This time around for the end term survey, we made sure that we did it in one go. And of course, we should be investing a lot more in cat catching resources. So we need to increase the number of cat catchers that we have, or maybe train more field volunteers to catch for us, because more catchers means quicker roundups, fewer missed cats, and less stress on our individual team members. And of course, we have realized that to measure impact and determine emerging hotspots, we need to repeat surveys often. Now, for that, we will need more field staff. And I think regular assessments will of the populations will ensure that our sterilization rates stay ahead of reproduction. So, with this, we conclude our presentation, and thank you so much for your time and attention.